New at 6, federal dollars to tackle an epidemic in our state, HIV and AIDS. $1.5 million now is on the way to DeKalb County to expand services.
But the issue continues for patients struggling just to get their medication, a delay that could possibly kill them. Here's John Sherrick tonight.
He searches online for HIV/AIDS treatment centers in Atlanta, and he finds dozens of providers willing to treat him. And then?
And then you pick up the phone, and then they tell you to come in within 2 weeks to a month and a half.
Is that acceptable?
Absolutely not. Absolutely not. It can't be acceptable.
Michael Lamb is an HIV patient who just moved to Atlanta. His medical costs are covered by the federal government's Ryan White HIV/AIDS program. But what's it been like finding a provider, getting an appointment with a doctor?
It's been a nightmare.
And the irony is Michael Lamb works for an HIV/AIDS advocacy organization called Thrive Support Services, counseling patients on how to get medical services.
And all you wanted to do once you moved here was what?
Get into care and get medicine. If I don't have my medicine, my viral load spikes. I can go from an HIV diagnosis to an AIDS diagnosis, and that could lead to death without my meds. It was probably about a month and a half before I saw a doctor.
Why was that?
The wait was too long.
The need is acute. As of 2017, according to the Georgia Department of Public Health, there were more than 55,000 people in Georgia living with HIV, and 34% of them were not in care. Nearly 19,000 people for many reasons, including difficulties in accessing the care they need.
You don't want to have anyone waiting. We have an epidemic that we know we can address.
Michelle Allen with the Georgia Department of Public Health says Georgia is one of only 8 states that receive federal funding for CAPAS, Care and Prevention in the United States, aiming to link HIV/AIDS patients to caregivers without red tape or delays. And the $1.5 million DeKalb County is now getting to expand and enhance patient services is expected to be followed by millions more for the rest of the region so that patients, Allen says, will not have to wait for care.
I would say that enhanced resources should address increasing access, increasing rapid entry, and I'm very excited about the opportunity to get those funds in the state of Georgia.
Michael Lamb is now back on track with his treatment and medication. Hopes now he'll be among the last patients to endure delays in care.